Good evening, everyone. Let's call to order. I'd like to call to order this meeting of the February 27th Dunn County Health and Human Services Board. Let the record show that citizen members Dr. Hall and Mr. Lamb are here. County board members Steen, Hagan, Bashand, and Morehouse are here. Supervisor Breslin and Ms. Rudy are excused. And thank you all for being here. I was worried that we were not going to have a quorum. So I would like to, you have them in your packet, the minutes from our January 23rd, 2025 meeting. Does anybody have any questions or clarification on here, on the minutes? I would like a motion to approve the minutes. Supervisor Steen,
So moved, Madam Chair.
Dr. Hall, any questions, problems, issues? If not, all in favor of approving the minutes from our January 23rd, 2025 meeting, say aye. Any opposed? The minutes from January 23rd are approved. Our next meeting is March 27th. Always feels like this is going really fast. Any problems with that? Regular meeting date? All right. Oh, thank you. I always forget that, don't I? Is there any public comment? No? Nothing in email? All right. Thank you, Supervisor Steen, for telling me how to do this, because I need all the help I can get.
You're so welcome, Madam Chair.
All right. Item number 7. We are glad to have the Family and Children Services staff here to talk about your work, but I think to talk about really good things that we all need to be aware of. So I will turn this over to Paula or Becky and let you take it away, please. Turn your microphones on, please. Thank you very much.
Okay, how's that?
Yeah.
Okay. I am Carrie Nearing, one of the Family and Children Services managers here at Dunn County Human Services. I've been here for 25 years now.
Goodness. Thank you.
Yes, and this is Lori Radcliffe. She's another Family and Children Services manager. And how many years have you been here, Laura?
21.
Yeah.
Wow.
Right. Yes. So we're some oldies. Oh,
Yeah.
thank you, Cassie. Oldies.
Oldies.
We
Experienced.
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 Yes, we're experienced.
Right, exactly. And they still are 16.
Yes. So for several years, I managed youth justice, and I recently did a switch to manage initial assessments in child protection, and then Lori took over the youth justice piece. So we're here today to talk about some cool things going on in youth justice, but it kind of started when I was in youth justice, and then it transitioned over to Lori. So that's why you're getting both of us tonight.
That's great. We're glad to have you. Thank you so much.
Okay, so we're here to talk about youth leadership team, which historically the youth leadership team has the Department of Children and Families basically created it. And they asked for counties to get on board and to invite youth to this team. Basically, the qualifications were that you needed to be between 14 and 21 years old, and you needed to have some experience in the youth justice system. And they wanted to really basically transform the youth justice system. They thought that it needed some work, and they really wanted to get the youth's voice involved when they were transforming. So back in the day, you probably all remember, really, youth justice was called juvenile justice. It was the juvenile justice system. And through YLT, when youth came to the table, they basically said, look, we don't like to be called juveniles. Like it leaves a negative connotation. It sounds like we're in trouble, like we've
Huh.
bad. We don't like the word. And the state worked with them and they basically transformed the whole juvenile justice system to youth justice. And that was based off of the youth's voice, which was pretty cool. I think that that's one of the coolest things that's happened, but and just a really huge movement for the state of Wisconsin. So basically, you could go to these different team meetings, and a lot of times the social workers would take the youth to these meetings and they would facilitate these conversations, and then the facilitators would bring the youth voice back to the state, and some really cool positive changes would be made. So youth leadership teams, I mean, they've kind of had, you might be able to get like one youth kind of involved. They would get a $25 stipend basically to show up. And of course, they would always try to entice them with feeding them because food really, really helps with youth. But not a lot of youth were really interested. They might attend 1, 2 meetings, and we might get one from our county, a lot of times none. And so the state has just recently they wanted to build the youth leadership team meetings up, and they asked if counties wanted to apply to basically really help get more youth involved. And so recently they gave us the opportunity to apply for a $14,000 grant for the sole purpose of growing YLT. So we applied. It was a very, very easy application, which was very appreciated. And we got the $14,000. So now our YJ workers have been really working hard at talking with all of the youth on their current caseloads, as well as reaching out to youth that have been served in the past. So we have some youth that are amazingly attending, UW Stout and still around in the surrounding areas, and they're coming back to the table to join these YLT meetings. So we offered them $100 gift card to attend, and food, of course, but $100 gift card because we have this grant funding. So very happy to report that in the first meeting of 2025, we had 11 youth come, which I think is an amazing number. Okay. Is this your one? Or you want me to do this one? Oh, I can do this. Okay, so just some of the youth, when they came, they thought that it was a bit intimidating to share their thoughts, feelings, and opinions with such a large group. And so we've decided that in the future, and we told all the youth this too, that we will break them out into 2 or 3 smaller groups and offer them that smaller group setting so that they feel safer to share their thoughts and their feelings. And we're also going to be building in opportunities for them to grow their skills so they are more comfortable with sharing, more comfortable with public speaking, more comfortable talking with people that they might not know well. And so we're incorporating some group classes and outings that are really going to focus on social skills and allowing for them to have experiences that they've never gotten before, in hopes of really being comfortable with YLT and growing their skills along the way.
That's where I come in. I feel like I get the fun part. She did
Push the microphone over just a little bit to make sure that you get picked up.
Carrie did the work of applying for the grant, and the first grant of also the Youth Innovations Grant, which is kind of piggybacks this grant. But one of the goals is that we really wanted our youth to feel heard. I think oftentimes adults don't sit and listen to the kids. They just decide what's going to be best for them. And our staff have done an exceptional job of really meeting with them, asking what it would take for them to get there, what would be the most important to them. We want their voices to be heard and have an impact on the youth justice system. And like Carrie talked about, gaining skills along the way that oftentimes we overlook. It's basic skills that sometimes these kids have not learned in this family system that they came from. And that's often a role that our staff have to incorporate in their relationships with the youth. We hope to do part of this and part in the growth and expansion of YLT across the state. There has been great positive relationships and a report that our youth are seeing that they have a strong relationship with somebody in their community. And I think having 11 youth come to the table that's a big number for a small county. We don't have, we have, youth justice kids that we work with. But 11's that's a huge number. It's a great outcome. That was based on the work that our staff did that really relentlessly, went after those kids that knew that could have a good impact.
Especially those 19 and 20-year-olds that are out of the youth justice system and they're willing to talk to their social worker, their old social worker, and come back to the table, I think is pretty cool.
Which means like those staff are working late too. They're
Sure.
they're not getting done. They're staying till 7 because they're the ones having to go pick up those youth to bring them back home. What would you guys want to eat this time? What do you want to do next time? What's the not the prize, but what's the incentive that would mean something to you that you may not have had an experience? I guess that's part of the bright spot is like the grant's a great thing, but it's really about the work that our staff have done, that we have staff that we have some really tough kids in tough, challenging situations and placements. But that only accounts for a fraction. That only is like the work that sometimes we need outside sources that we can't accomplish what's needed for those kids. But with what we have, they're doing hard work and they're meeting these kids where they're at. Some of the things that we hope to do in the future for a lot of the same population is to partner with UW Extension Office, and we met with them just a few weeks ago, and we're going to create a community garden where the youth are invested in taking on that project. Different pro-social groups that we have a program aide that's going to assist in doing things that he's always done, these great groups, but gearing it towards more of the adulting skills that sometimes they're missing. So banking, maybe going to CVTC, cooking classes, learning how to have a garden and life skills. So we have 6 youth justice staff. 1 is the program aide and 5 are the ones doing the work and meeting these kids where they're at. And I think it's just an important bright spot for the board to hear that although there's some challenging things that we face, there's some really great exciting things that this group is very excited for this year to have the grant to be creative and give these kids opportunities with this grant as well that they have not had.
Any questions or comments? Yes, Mr. Lamb.
Thanks. I kind of maybe missed this at the beginning. So the participants, the youth that are participants are folks that are like in that system for some reason. Is that right?
Yeah, so the youth that are being served they have to have a delinquency order at one time or have either currently or in the past.
And then this is the part I think I really missed. or got half of it, is the development, I guess, of this program just sort of started to happen organically around the state or at the state level and then down, or explain that again, how it all first
Yeah.
got going.
So it started with the state. And then, they asked the counties to basically try to get youth involved. So that was, we did that for several years and you might have, that's when I said you might have one youth that would participate. They got that $25 stipend for coming and participating in a meeting. Some of those meetings actually were down in Madison and then some were virtual. They would kind of switch it off every other month, virtual Madison. Um, but then, they just didn't have the participation numbers that they really wanted to see because they wanted to see, they wanted to hear from a lot of the youth in the system and across, all 72 counties if possible. So that was when they reached out, then the state reached out and said, here's a grant opportunity, for you guys, if you're willing to really try hard to grow these numbers.
Thanks.
You're welcome.
Have there been structural or other changes that have been made at the state level from, given the kind of feedback that these young people would provide?
Yes, like the last meeting, I think it was just, which was another cool topic. So they kind of pick a topic every meeting. But the topic from last meeting was asking the youth, what do you want what do you want to see for training for your social workers? What do you want your social workers to be
To know.
trained in?
Interesting.
Right? And I thought that was a great one. So, and they'll take that feedback and then they will incorporate it into trainings. So,
Interesting.
yeah, there's really been, I think a lot of great positive changes, like secure detention doesn't work, those types of things. And then you don't learn anything by going there and then, the state really putting on trainings and teaching workers and managers, secure detention doesn't work. Let's try other things. Just lots of different things. So
That's great.
Yeah.
That's great.
Yeah. So
Anything else?
important to listen to those youth because they really do have great insight and ideas.
Sure. Supervisor Kagan.
Thank you. I'm actually really super excited about this because for the past few months, I've been thinking about trying to get more youth involved in government in general, especially at the county level as well. So to see a program that's flourishing like this is a great, I think, model for us to potentially expand to other aspects of county government. I was also wondering for the youth under 18, have there been any hiccups in getting guardians or parents or anyone to sign off on their kiddos being a participant in this program?
I don't think so. I don't think that there really have been. I mean, transportation has probably been the largest barrier, but the workers have been committed to going and picking the youth up after school and then bringing them home so parents don't have to worry about that piece. So the workers just kind of take the barriers, I think, away, and they know that they're going to be with the social worker. They're getting $100 stipend plus that additional $25 one from the state because they're still offering that too. So they're really getting $125. They're getting fed for the night, which is great.
Well,
Lots of pizza.
Yeah.
And we're trying not to do pizza. We want to make sure that these kids are picking. Like one kid said, when I had introduced myself to some of the kids, I'm like, what's something you would want to have for dinner? He's like, hibachi. I'm like, okay. I'm like, I can make that. I know I do. I can make that, but let's try to figure this out. Yeah. Because that might not be, I said, have you ever had it? He's like, no, it's too expensive. I thought, that's true.
Right.
But really giving them the opportunity to try something that they've never had an opportunity to do.
Sure.
But I go back to the workers are the ones that they're the ones doing that work to build that relationship, even for them to say what really matters to them is just key in this whole program, and really moving away from consequences for youth and working to build the relationship, and that's key in
Mhm.
everything we do.
Yep, build those skills.
May,
Fantastic to hear. Thank you. Go ahead.
Oh.
Sorry.
I'm sorry. I wanted them to share the example of the youth that was at,
Rawhide.
Rawhide, yep, because this is the team that in the next year is going to have conversations with other county board members and community about the cost of residential
Yeah.
placements, because you all read my board report, because I know you do that well, and all the cost in there. And they had an experience with this group with an individual that came back from Rawhide, and his influence kind of in that group. And so I wanted you to hear some positives that come out of placements as well, because you need to be the voice.
Absolutely. Thank you.
So I'm just gonna make up a name. His name's Mike. That's not his real name. But so Mike was a youth that came into our system initially there was some CPS history. Fast forward, behaviors continue to escalate. Had many contacts with police, almost on the daily. He was completely he was struggling, and eventually we had to place him at Rawhide, and he was there for, off the top of my head, I want to say 6 to 8 months, um, which is about the average stay at Rawhide to have some positive outcomes. Um, and he returned home. And with that, he was able to advocate for himself about what he needed in his home to be successful. He knew that he could do that with additional assistance and help, because his mom and him have a pretty tough relationship. And so he has had a very strong relationship with one of our workers, Markella Fiore, and lots of conversations about serving him and continuing to have him gain independent skills. He's one of the participants that came to YLT that night and was a leader in that group. He came to that group saying, I think like all in the same group was like, oh, I had to be at, residential and Rawhide. It was so stupid, blah, blah, blah. I, disliked it. But by full circle, he was able to see the outcomes that he was able to achieve from being at Rawhide and the skills he gained. It's not ever easy. He was, it was a tough road, but he has been successful and has learned to advocate for himself, even when there was an additional police contact after he returned home. That was not his fault. He made the appropriate decision and choice as to what he needed to do to get out of that home. Just a great, great success. But now he's coming out as a leader and able to advocate for himself because he's heard by that worker and saying, this is what we need to do.
He's also got 2 workers from Rawhide that continue to check in on him all the time that he was connected with there, and they constantly follow up with him,
Yep.
show up for him, come to meetings still if they're, asked to come to meetings. And so I think that that's pretty cool too, and definitely just helped this young man along the way.
Mhm.
That's a great story.
He's the hibachi kid too.
He's a hibachi kid.
So we're not
With-
just taking kids out of the community and putting them somewhere so they don't,
In jail.
in jail, so that they're not, engaging in more delinquent behavior. It's really about how do we reform and,
We tried
restoration.
lots and lots and lots and lots of things before we have to get to a place like Rawhide.
Sure.
Yep. Yeah.
Well, we appreciate the work. Any other questions or comments from anybody? Supervisor Hagan, anything else? I can
No,
see that
this
you're
is-
ready.
Yeah, no, just more comment and more just accolades. This is fantastic. And I'm just mulling in my head how to make this work again for other services. Because as you pointed out, having that skill to be able to advocate for yourself, but also know what you need and have that courage and that voice to say, hey, this needs to change is wonderful. I'm glad to see the younger generations having those skills. So thank you.
Supervisor Steen?
Yes, I'd just like to thank you ladies for your work.
Oh, thank you.
Yes, thank you very much, both of you, for being here. It was really uplifting. We need some uplifting these days, so.
do. Yeah,
No,
we
thank you.
all do.
Thank you for that,
Very
and
much.
thank you for the
Welcome.
extra
Yeah.
effort, and you do not have to stay if you don't, and you can stay if you wish, but you don't have to. Yeah, and thank the staff, and tell them to this committee thanks the kids.
Yeah.
Youth, I should have said youth, not kids. Yeah. All right, thank you. Thank you. Moving on to agenda item 8, Veterans Service Office. Greg, it's in your court.
All right, good evening, everyone. I'll start evening's brief off with the memorandum formatted document, as I always do. Starting off for the month of February, locally there is nothing significant to report locally. And on the state level, of course, the governor's budget has been put out. I had just had a meeting last week with Secretary, the Wisconsin Department of Veterans Affairs secretary, and he kind of presented on the highlights as it relates to supported veterans items in the budget. And I just overall, I would identify that there's good support at the state level for the veterans, and there's a small service officer grant increase that was placed in there as well. And also got a tour of the King Veteran Home, which I hadn't seen. I've been, of course, over at the Chippewa Falls Veterans Home, and the facilities are remarkable, and people that work in those settings are dedicated to the work they do. I wouldn't say they're dedicated to the money. They're doing it for just because it fills their bucket. And so it was nice to see that this setting, and they've got a low census, and we're talking about nursing homes over there. However, the Chippewa Veterans Home is full with a long waiting list. And so I always take the opportunity to identify what a great area this is, and for our legislators to support funding an expansion over there, because it is a beautiful area. And it accommodates our local veterans and their families. On the federal level, just to speak a little bit about just kind of change in administrations, and just again broadly, been through three administration changes in my tenure here, and each administration brings questions, concerns, and support from everyone that kind of comes through. And what I would our consistent message is that each administration has done good things for veterans in our as a whole. They've added benefits, and I can go back to President Obama through President Trump through President Biden, that have all added and increased benefits for veterans. And so that's kind of the consistent message that we have, that the benefits and the support are there. As we move into more specifically the Veterans Health Administration, there's information put out about labeled firings, labeled a variety of things. And I would just encourage people, as I tell them, just kind of read into the details and minutia. There's, as far as healthcare, there's 130 occupations that are exempt. And in person, I know individuals that attempted to take the early buyout, which they got declined because they're considered essential. I was over at the Chippewa Clinic this week, and so there's it's business as usual. We haven't seen any degradation of care, and I don't anticipate any of that. Again, there's only been improvements for our rural area with the expansion of community care, but there's still a large need for the brick and mortar, like the Chippewa Clinic, Rice Lake, and so for as far as that goes, we haven't seen any delay in anything. I do know that there's some changes with how to get community care approved, but there's certain areas, and I didn't ask for the specific details about what specialties. I know audiology, it's easier, ENT is easier, but there's some of the specialties that are going to be a little bit more complicated to getting those approved authorizations. On the benefits side, again, we haven't seen any delays on the veterans benefits side, and for that matter, I wouldn't anticipate anything. There's kind of an equal movement of automation. Sometimes that works great. Sometimes there's some hiccups with that, but that's why you have individuals that closely follow and closely review all of the disability claims that are going forward. There's we've already been reporting on the challenges with the CHAMP VA program. Don't anticipate that to improve immediately, but that is the lawmakers are aware of some of the challenges there and have been working on that for like 6 to 8 months, as well as the appeals side, the Board of Veterans Appeals. There's just long delays in that, and I've kind of briefed, and I anticipate the same, where it put emphasis on reducing the time it takes for certain areas, let's say appeals, but when you dedicate staff, take capacity away from one area to bring that down, it's gonna go ahead and slow things down another. And so that I anticipate some of that going on, but we haven't, we've already been informing people since last fall, is the VA had decreased or stopped overtime pay on the benefits side in processing. So we've already been telling people, hey, we're going to anticipate probably another extra month before things. So they're prepared for that. So and I don't hesitate to remind people, like, hey, 13 years ago, it took a year to get an audiology claim through, and now those are typically average time 4 to 5 months. So there's been huge improvements. I don't anticipate a step back, but again, that's today's report. We just cautiously watch to make sure that we can educate and inform individuals that have some questions or some concern from us. Any questions about that?
Questions for Greg? Supervisor Hagan.
Hi, Greg. Thank you. So I heard that there was a certain classification of veterans that may be denied care from this current administration. I was wondering, has anything like that happened in the past? I've only been here for 3 years. I don't know if there was any time in which veterans who've served our country come back have just been said they can't have any services. Has anything like that happened?
I'm not aware I'm not aware that that's been proposed for any veteran, because that's something you earn, and there are priority groups that you have to meet for your care, and if you meet any of those priority groups, you meet those standards.
Did that last month.
Yeah, you're entitled to care, and if you served on active duty and were released under honorable conditions, you have that available to you. There are some of the, if you don't meet some other special qualifiers, which I can go into detail, and maybe I can do that another board meeting. But there are some income tests for certain groups, and so what I've seen is things have been opened up a little bit more, but that was all in motion with the PACT Act. And so do you have any specifics? And I can do a little bit of research about groups that are being potentially.
Sure. Yeah. My classification is specifically for trans veterans. I would not assume, but I would also not assume that there are any specifically in Dunn County, but I do know that Chippewa Valley has a notable trans presence in general, and so this would kind of fall into that category. So that's the news that I've been hearing, is that trans military members are being one, denied service, and then when they do come back from service, are being denied care from the Veterans Administration.
Veteran's a veteran. Regardless of status, gender, your status is you're a veteran. And so if there are, if there is some specifics of individuals being denied any type of care, I would suspect that that could be certain VISNs, which Veterans Integrated Service Networks, that may be imposing some of that. But it is absolutely true. You serve your country, you meet a special qualifier, that regardless of what religious, gender status, you are entitled to health care. There may be some situations that some areas may not have the some of the services that are particularly necessary, but that's why we have the community care program. So that's something I can certainly look into, but specifically speaking, a veteran's a veteran. Doesn't any of the other identifiers, that has no bearing on their access to healthcare. They meet all the other, like, under honorable conditions. And so that's something I'll follow, certainly. But yeah, I haven't encountered that.
Thanks for the question and thanks
Yeah.
for the follow-up.
Yeah.
Madam Chair?
Yes, Supervisor Steen.
Yeah, Greg, I would just appreciate a monthly update on this. Keep your eye on it. There's a lot of hyperbole what's going on in Washington. I heard this the other day, which makes sense. Don't pay attention to all the talk. See what actually happens. But I have not the faith you seem to have. So you just please report, because I'm very, very, very nervous. We were just at a legislative conference and they were talking about Badger Care, Medicaid. And I was stunned to find out that 50% of the children in Wisconsin are covered under Badger Care or Medicare. Now, I had no thought of that, but I mean, just think about that. And it seems to me that this government is an equal opportunity situation, in that they don't care who they pick on. So while I'm confident, and this whole board would reiterate what you said, you're a veteran, you serve, that's the qualifier. Well, unfortunately, you ain't the guy that gets to make the decision. So that's the hell of it. So if you'd kind of keep us updated.
Yeah.
Supervisor Steen, I am the guy that gets to hunt that, though. If somebody is not receiving what they've earned, I'm the individual who gets to advocate and take it to the appropriate level. So that's something you can count on from our office.
We have
for
pretty
sure.
confidence that
Yeah.
you're gonna be there.
Maybe I
That's
shouldn't have
that's
used
not the
hunt
worry,
that.
I think. Dr. Hall.
Not worried about you.
So just a little update. So as of this point in time, there have only been 20 VHA employees that have been terminated or laid off, right? So the deferred resignation, the voluntary thing, that, yeah, people were like, no, you're not eligible. So there've just been 20 workers at the Minneapolis VA who have lost their jobs. The director of the Minneapolis VA had a meeting with staff last week and said there will be additional cuts coming. They initially said that no job category will be spared. And then today they said, well, physicians who are non-probationary will not be laid off, but no such guarantees for nurse practitioners, physicians assistants, those types of things. I do know that at the Rice Lake Clinic, they had made arrangements to hire a new physician who had left their job and who had moved to Rice Lake, but had not yet started employment yet. And they were not allowed to be brought on board. So there, so it bears watching. It bears close watching. That's
Yeah,
for sure.
it definitely, thank you for that. It definitely bears watching and yes, Mr. Lamb.
Greg, the one thing that I guess I'm worried about. Up on the, someone comes in, they have a claim of some nature, you do what you always do very well and move that forward to the federal level for review, processing, and so on. What I've been worrying about, because of how you educated me since I've been on this board, is what's going to happen, because I know at the federal level, I just pulled up something I read earlier today to confirm the number. There's been 1,400 additional folks were let go on Monday. And then last week or whatever, I think this now brings the total to somewhere 2,500 to 3,000 people. And I don't know within the VA if people that process claims and all the other things that happen there, if they're considered, mission critical or whatever, because so that's something I'm very concerned about. And I know it's early and I know information is sketchy and whatever, but have you heard anything yet as far as how some of these cuts might affect processing times? Like you mentioned earlier about a while back, it was a year, now it's 4 months. And so that's something I'm deeply concerned about.
Absolutely. If if you cut capacity logically, you should see delays or quality issues. And so, we've already been anticipating some delays just because of the reduction of overtime. However, I think it still bears watching to see how the impact, if there's any reductions in that VBA side of things, and certainly the onboarding of quality staff at the VHA, VBA, and the Board of Veterans Appeals, stalling that because they were already underwater with not having enough. So that's where, my optimistic view is kind of a static level. And until I'm proven that it is taking a step back, then that's what I'd be reporting. But because the other part that's not factored into this is the existing quality employee to carry out their mission, their dedication. As I kind of indicated, like the nursing home staff, and I viewed, you look at they do that type of work not for the money, but because it kind of fills their buckets. So that's that optimistic view, and wouldn't do the work that I do if I didn't carry an optimistic view. So, and until that changes, then with some actual factual numbers, times, reductions, because we've always been concerned about lag times at the Board of Veterans Appeals, and then we've been concerned about the delays in some of the other areas, and then quality in another area. But the people that are supposed to be fixing that are aware of that. So that's my answer.
When we were agenda planning for this month, I think it is very likely that there will be significant impacts on all three of the departments we work with. It's pretty early, but this is definitely going to be on our radar. And as more information is available, it will obviously always be shared here. That is a priority, because I think, we are looking at the potential of really significant impacts on our ability to serve clients in the county. So Supervisor Hagan.
Thank you. Touching upon what Supervisor Steen said, to watch the actions, not necessarily the words out there. There is recently, I saw today, a draft legislation in the House of Representatives called the VA Access Bill, or the VA Access Act of 2025. And Access is obviously an acronym, but from the language of that, it looks to be switching the Veterans Administration system from primarily a care, what it is now, into more of a insurance side and claims processing side of things, and would be transitioning everything to move veterans into more of the private sector. Right now, there's no number on it. I don't think there's sponsors yet, so it looks to be as just a draft, but just putting it out on everyone's radar that's out there.
Yeah, thank you. Privatization has been, we've community care was I'd say a step in that direction, but that is privatization. There is a group that fully supports that. Then there's a group like, no, we need to keep that care. So that is something to definitely pay attention to.
All right. Go ahead, Greg.
Yeah. I
I'm sorry,
appreciate the question.
Supervisor Bashan has a question.
Well, I'll just say privatization isn't a new thing in the military. I mean,
Yeah.
it's been around for many years.
Yeah, it's just there's the care that's being provided right now. The people that are providing it are doing a remarkable job. And we see that. I thanked all the people over at the Chippewa Clinic when I was over there a couple of days ago because they do a good job, and I hear that.
Take us on a tour.
Yeah, well, yeah, maybe we just take the meeting on the road sometime. Yeah.
Huh? All right. There's the quorum thing. Got it.
I'll provide another update. So another significant change that I think is it has the potential to be impactful, but as an association for the county and tribal veteran service officers, it's our job and responsibility to maintain and form a good positive relationship with our regional office partner down in Milwaukee. The current director left, retired, was a huge champion for what our organization did and viewed us as really kind of added value to if we do a good job, we have the ability to reduce claims backlogs if you do it right, less appeals and stuff. And so he was a huge partner with us, and he's retired, and their new director's onboarded. He is committed to come to our spring conference, and that comes up to our leadership and association to start that relationship, joining and forming with them to just keep that partnership there, because the information they provide us, we get information a little bit ahead of time. We kind of get the temperature that's going on all the way up to the central office down, so that's helpful. So that's something again that we'll be trying to maintain, but that's another change in
Right.
things.
Right.
Madam Chair,
Yes, Supervisor
I
State.
got a question for Greg there. Our WCA board meeting is in Green Bay in March. Are you guys invited, or is the vets planning to address us over there or not?
I believe that we're gonna have a table. I'll follow up on that. Might be one of those.
I remember a couple of years ago, we had a meeting where you guys, the top dog from Milwaukee came up, you were there,
Mhm.
and then you guys had a presentation for the Wisconsin Counties Association Board. And I was just wondering, and I can call our chairman, Lance Pimmel, and ask him if that's on our radar, which I think it would be, because every county is up to their knees in badger care and veterans and all this stuff, so it'd be a huge thing. Let me know if you hear anything, if you haven't been scheduled.
Yeah, thank you. We've got a legislative team that tracks some of that. There's a lot to keep track of.
A lot to keep
So,
track of.
But I remember a couple different meetings, and it's huge value for any of our offices to ensure that the county's association is aware of the work that we do and to get their support as well for the efforts. If there is any
Move
other
along,
question?
Greg.
Okay,
Yeah.
all right. Nothing significant to report for 2025 budget. A couple months into this, I do have a carry forward for 2024, which I'll address when we get to the action items. I'll move right into the impact statement. And I included the 2024 to compare to,
Right.
well, I labeled them both 2024, so I apologize. The one that's
It's all right.
empty
We
is
figured it out.
2025. Thank you. So I'll make that update, and I'll let you can read those impact statements, and it just the one is just it's just important the effort that's placed into doing some research into medical conditions and how different exposures can impact them, and then how that can be really a life-changing thing when somebody who is covering their healthcare costs and really upside down a lot, and you can get things validated, and then they don't have that. They can receive the care that they've earned cost effectively, and then for any of those damages from those injuries incurred, they're able to be compensated a little bit. Sometimes quality of life, you've already walked that road with a decrease in quality of life, but it is some consolation just to have it recognized. So I'll let you guys can read those, and if you have any questions about them, you can certainly reach out to me. And with that, I'll close up. So we talked a lot about the federal side.
Any other
The-
questions for Greg on the
I'm sure
impact
there'll be
statements?
More questions and
Impact
discussion.
statements or budget or anything else? All right, thank you.
thank
We'll move along. Thank you, Greg, very much. And thanks, everybody, for the discussion. Moving on to. You anticipating me? Moving on to number 9, the Department of Public Health Staff Report. Please, KT.
So thank you guys. I did get your packet out a day late, so hopefully you saw that email come through. And then, so you have quite a few things, very large documents. I would not encourage you to print them out and kill the trees. So some good reports on the status of HIV in
Yeah.
Wisconsin. So recognizing that different populations are disproportionately impacted by health outcomes. And it is our job in public health to address that with dignity and equity and inclusion. So just kind of using that language to say, this is really about populations like rural folk, like folks that have different impacts in their personal life, that really do have different health outcomes, and it's our job to meet them where they're at. So just kind of placing things there. So you guys will continue to get information from me on that. So in the packet, you guys saw my updates. There was some specific questions around measles and specifically high path avian influenza. And so there was some content on there. I did give you guys a snapshot of measles. So I was really happy to see that CDC has updated their measles outbreak page to no longer be updated once a month, to now, as of today, will be updated once a week. Still not necessarily the kind of responsiveness, making up words now, responsiveness that we would like to see, but better than once a month, which really would keep us in the dark as far as that goes. So currently there are, let's see, I wrote it down, 133 total cases of measles, predominantly in unvaccinated folk, in, again, predominantly a plainclothes community or plain community in that part of West Texas, close to New Mexico. So when we think about measles, we think about just the incredible ability to transmit. It is one of the most infectious diseases that we have. You can be in a room after the person has left and still potentially be exposed. And it needs a herd immunity or a vaccinated immunity of about 95% to not move through a community. So in that particular plain community, vaccination rates were very low. I did want to point out something that I watch, and I'll go ahead and share my screen real quick, that is of importance to this group, is our vaccination rates are fairly low.
I was going to ask about that.
Yeah.
And you can see that in a couple different places. Let me get to the right spot. One friend. So this is the Environmental Public Health Data Tracker. So these are all vaccinations. And you can see that we are not the worst in the state, but we are definitely not where we need to be for prevention of a measles outbreak. So again, this data is new-ish, 2021. And so we know that vaccination rates are going down.
I'm sorry,
Yeah, just
AD.
go ahead.
So I see Dunn County up there and it looks like there's a percentage. Am I seeing a percentage?
76.9.
I thought it was 78, so my eyes aren't all that bad. And that signifies, that's our,
So this is specifically
76
to the measles, mumps, and
that-
rubella
MMR.
vaccine for children that are up to date at 24 months. So that's a good indication. Do you have a follow-up to that?
I do. So, and I suppose you may not have it with that information there. That's up to 24 months, but. Sorry, but I'm assuming and hoping that it's much higher than that when it gets to be, say, kindergarten age.
Let's look.
Let's look at the data.
Okay,
According to WPR, it's not.
so it's not, and we have a great, if I could figure out how to get rid of this little, there we are. Let's see. Okay. So every year, our public health nurses work with our schools to make sure, why is that so large? You guys can probably place yourself on this map. You're here, right?
Mhm.
And this is our school districts. They share their vaccination rates. You will see that there are several different school districts within Dunn County. Come on, friend. I don't know why it's not working. Why aren't you working? So,
Usually let you see the data.
yeah.
Mm-hmm.
So we are, maybe I'm not zoomed in far enough. I don't know. Come on. Okay. This is usually a pop-up, and so I'm sorry for showing you this in this crazy format. The district, a school district of Menominee area is at 89% fully vaccinated. So they met all of their minimums. That's still not 95, but that's the best we have in our county. Let's see if we can go through the same thing for and again, this is not specifically in our county, but we would have students associated with it. So this is the Glenwood City. Let's see if we can get this to come up. 70%. Yep. Well, that's not what I expected it to do.
Surprising you tonight.
95.
Wow. Good job. Boyceville?
And as you get into, they can actually show you, you can see by school. And so when you see the elementary schools, you can see what their vaccination rates look like. But all of this is to say that we come nowhere close to having sufficient herd immunity to prevent a measles outbreak if it were to be imported, either because they were visiting somebody that they love and know in Texas or abroad where there is still regular outbreaks. So as a reminder, we are seeing that it's bearing out again that about a fifth of the cases are hospitalized. And we have had our first death of a child from measles from this outbreak, and a healthy child. So challenges.
What's I've heard a couple different numbers. For kindergartners to have a human, once you get to kindergarten, I'll just go with that because that's the number I have in my head, or the cutoff, or whatever, the start. To achieve herd immunity, what's the percentage vaccination rate necessary?
Well, it would-
92,
It would be 95.
95.
So that's where you have enough folks in that space that it's not going to move through in the same way. It doesn't, I would imagine that there is an epidemiologist out there that would say kids are gross, they put things in their mouth, they share their germs a little bit better, and so maybe you need more than that. But I've not read anything to that specific.
Go ahead.
Okay.
Thank you.
So talking about measles is something that we're watching. We are less blind than we were, but we are still not necessarily appropriately kept up to date with
worried about
our typical federal partners aggregating that data for us. So I did have to hunt and peck to find it.
And thank you for doing that.
Yeah, absolutely. So the other thing that I wanted to share in the question about was high path avian influenza. So USDA data is still up to date, and the Wisconsin equivalent is also up to date, DATCAP. And so with avian influenza, we have had in Dunn County, you're fully aware, we have had both commercial and backyard flocks with positive cases in Dunn County, none recently, thankfully. The most recent outbreak in Wisconsin is on the DATCAP website, and it was in December. So we've had a couple months, and my expectation is that we will continue to have it until it is warm enough to where it no longer survives. Yes, sir.
Is Wisconsin doing any testing on cattle for avian flu?
Not that I'm aware of.
But some states are starting to do that, correct?
Yeah.
Okay, thank you.
Yeah.
Yeah, Supervisor Hagan.
On that note, I was reading that it's already endemic in cattle. Would it, I don't want to say behoove,
That was,
but
whatever.
yeah. To inform farmers, of, like, I love this handout, the one sheet that you have about,
DATCAP.
yes, it's great. Is there, methodology to get that to the different, dairy producing farms, in the county of any?
So we've not done that. I will tell you that when we had our backyard and commercial flocks, we did send out notification. We got a lot of take me off your list
Sure.
Huh.
feedback.
I want to say understandable, but understandable.
Sure. But definitely a possibility. And then, I'm sorry, high path avian influenza cows. So we are seeing more species being impacted, kind of to what you were sharing, Supervisor Hagan. We do believe there is some evidence to share that we've had transmission from dairy cows to people, from dairy cows to cats, where it's particularly fatal. And so we're continuing to watch that. But what I did want to share is that Wisconsin has done some really good work to improve their processes around notification and coordination. DATCAP and Wisconsin DHS had a real rocky road around who's responsible for what and how do they communicate and when did they let the locals know. So 2 years ago, when we had our first situation, it would be very different than the most recent one that has happened where they were talking about the changes in coordination. And so I'm very proud of our local public health process working across agencies and with industry to prevent spread. Any additional questions about high path avian influenza?
Supervisor Hagan, you get one more.
One more, and this is, I will be the one saying this, but I would recommend people to not drink raw milk, at least currently. So take that as
Forever?
you will.
Forever. Dr. Hall, did you have a comment?
Yeah, so I'll just piggyback on that to say, yes, absolutely. So for reasons that are not clear to me, Wisconsin is choosing not to participate in the milk testing program, despite being one of the largest suppliers of dairy in the country. So we're not participating in that national milk testing program. So we don't know. And you can get this virus from drinking milk, but the pasteurization process does make it safe. So as long as you're drinking pasteurized milk, you do not need to worry that you will get this infection from the milk. And in terms of raw milk, we have no idea if Wisconsin milk has this virus in it or not.
Mr. Lamb, you get one more.
If I could ask the question of Dr. Hall.
Certainly, yes, you may, yes, you may. You absolutely.
So I was not aware of that, what you just mentioned. So whose decision was that? Is that decided at the state public health or KT? Okay.
I don't know, right? I mean, so if there's something about if it's going interstate, if it's going out of state, it has to be tested,
Okay.
right? Because federal government can require for interstate commerce. But if it's within the state,
Oh, sure, all right.
There's no voluntary testing that Wisconsin is currently participating in of dairy milk.
All right, go ahead, please, Katie.
And then continuing to talk through some of the communicable disease impacts that we're seeing. So you also have the respiratory report. You guys have seen that over and over. And what you're seeing is a very, very high circulation of influenza, also RSV. And so there has been some conversation about this being the most, a very high circulation year and a high impact year. And so I wanted to dig into the rationale behind that, and happily, today in the MMWR, Morbidity and Mortality Weekly Report, that is now back up and going. It had paused for a hot second, but it is now back up and going. They did release, just like they did this time last year, their interim estimates on the 24-25 seasonal influenza vaccine effectiveness. So showing that actually it is fairly effective. There is one group where there's maybe a little more variation, and that's in among children, preventing any kind of urgent care need for influenza. But as far as hospitalization and then any kind of need for urgent care or hospitalization in both folks over 18 and most importantly over 65, really good protection, or rather protection consistent with previous years, not at that COVID level, but still, anywhere between 45 and 55%. That's good to hear. I would also share that one of the, so CIDRAP out of the University of Minnesota has put out a couple articles to this effect, and it stands to reason. Our influenza vaccination rates are abysmal. In Dunn County, we are at about 25%, 24% of our population did take the vaccine for this season's year. And the statewide, we're at about 1 in 3. So when we're seeing a really significant impact and we're not seeing a mismatch with a vaccine, that really points to the fact that vaccines work, and we are not preventing the illness that we otherwise very easily could prevent with reasonable uptake with vaccines.
Yeah, good point. Yes, Dr. Hall.
So I just want to add, looking at that respiratory surveillance report on page 4, and you can see the graph of influenza seasons by year on the number of hospitalizations, right? And this year is just twice as big as any other previous year was. And that has huge impacts on our community, especially because we've recently closed hospitals. So a colleague of mine had to take their kid in for croup last night, to Eau Claire. They were literally in a hallway, being treated in a hallway. People are rushing past them. I mean, the hospitals are, from that anecdotal report, and certainly, hospital censuses change a lot moment to moment, but in terms of protecting our medical capacity. So it's not only just, yeah, whatever, if I get sick, but it's like, well, no. My friend's kid needs to be treated for group too. So it's concerning.
Yeah, very concerning. Yes, Supervisor Hagan.
I'm sorry, I feel like I have a fairly obvious question, but I just want to get it out there. I'm 40 years old, and let's say I've never been vaccinated for anything in my entire life. Am I too old to start getting anything? Do I age out of anything, or can I start getting like DTaP, MMR, and all that stuff now?
So I would encourage you to talk to your provider.
Sure.
There are ACIP recommendations on age associated with vaccination. Sometimes there are a couple vaccinations that are limited. So HPV is one of them, because the expectation is that you've already been exposed to the papillomavirus. I had to think about what's the V stand for. So yes, there are some that you would not qualify for, but anytime you want to start, your provider will meet you where you're at, and you can design with their input and your comfort a way to get back up to date. If you're most comfortable starting with the MMR because you're worried about mumps because it can very drastically impact male fertility, we'll meet you where you're at. So
Thank you.
just recognize,
You want to hear that?
just recognize that we always meet our clients where they're at. If we have an 18-year-old whose parents, now that they're emancipated, wants to start a vaccination process with us, we will walk that through. Their provider will also walk that through.
And we offer it.
Thank you. That's good information. Yes,
We
Supervisor
do.
Bashan.
If you're eligible for vaccination through the health department, meaning that you are on Badger Care, uninsured, or a couple populations like American Indian, we can vaccinate you with that here.
Supervisor Bashan.
So with the vaccination rates being so low for the flu, has it been that way the past few years, or is the vaccination rate dropping dramatically?
It is dropping dramatically,
Okay.
especially among children.
Thank you for that.
All right. So another thing that I wanted to bring to your attention after we've gotten through the communicable disease items is an update on a policy recommendation that we had talked about previously about infants at work. That has been reviewed by HR, and there is some concern about liability for the county specifically. So that was not approved for the health department to pilot. What you also have in the packet is a beautiful baby boy who was just born. And we're going to continue to work with that particular parent so that they can come back. It'll be longer until they come back, and then they'll come back part-time after that as well. So just to kind of come back full circle on that. And then one other thing that I want to put on your radar, and we can have maybe more robust conversation at our next meeting, but the health department, as well as many other county and nonprofit organizations associated with funding through Wisconsin DHS, received an open records request from Representative Shay Sortwell from the Green Bay area. And it is asking for an exhaustive amount of review and data to be sent in. So they are specifically looking for any grant that is DEI related. It has DEI in the title, in the description, or any kind of requirements. So it can be in the body of the grant or the title. And then also policies with the same qualifier, training programs, and titles and salaries of health department employees who are DEI related. So as you guys will remember, when I started my conversation today, the whole health department works on a premise of giving people what they need to be healthy. And a lot of that is removing barriers to access. So that could be rural health equity. Because we live in a rural place, your access to healthcare can be more challenging. That can be tobacco cessation in LGBTQ teens, because we know that is someplace where they were targeted very heavily by tobacco companies. And so there's a lot of work around that. It's basically finding those inequities and removing barriers or inserting ourselves to bridge that gap. So I would say a lot of the work that health departments do in general are about providing access, about treating people with dignity, and using language that people understand. So even if there is nothing, I have nothing in titles, I have nothing in my grant titles that is specific to equity, a lot of it centers on health equity. And so this will be a significant undertaking for my department to go through everything and provide any of these 4 types of records that could have something to do with equity. And so I wanted to put that on your radar.
The Wisconsin Counties Association Legal Counsel is on this. Our corporation counsel has been engaged, and so we'll try to honor this open records request with as little pain as possible. It wasn't clear from the WCA attorney's presentation yesterday that it's what the committee is actually, what the committee actually intends to do with these data, but we're on it. So thank you for that.
Yeah, Madam
Supervisor
Chair,
Thien.
my question is, what's our response then? And we have our county manager here, so perhaps we could get some guidance there.
Sure. So initially our response is we've received the open records
Mhm.
request, which is what we always do. And then we're gonna start putting together some back of the napkin calculations on how much time and how much cost we would incur to satisfy this. I think that the legislature needs to know what that looks
Right.
like for us. But then we'll work to comply.
And, there were some unreasonable expectations of time, but so that, assessing how much work this is and how much it's gonna cost is associated with open records request.
So I would assume that the time taken on the napkin and also to figure all this out will take an appreciable amount of time, correct? I hope. And
Yeah,
so that.
and it's
that-
from 2019.
Then our response would be, we're cooperative, it'll be forthcoming, but we're working on it. Does that make sense?
Yes.
And then if they never get it, well, that's the way it is, you know?
I'm not gonna say that,
We
but I
can't-
will
we
say
can't
that.
do that.
Well, I'm just saying, you're making a good faith effort to do it. If it doesn't happen in the period of time they want.
So the period of time was March
Third.
17th. So we're gonna work on it. We're gonna provide them kind of a what we expect it to take, and then we'll get it done.
I think maybe we should move on from
Just-
this
can I just
topic
ask-
at,
Quick question.
very quick.
Where did this come from again?
So it is the Committee
Assembly
on
Committee.
Government Operations, Accountability, and Transparency, also known as the
Vote
GOAT
Committee.
Committee.
Oh, thanks.
All right, let's move on.
Yeah, thank you for that. All right, so that's the rest of my report. Are we good to go on to
You had
financials?
something on the agenda about a grant application?
Oh, yes, thank you so much.
You're welcome.
So we just completed our first federal grant application. It centers on rural health equity.
Oh.
Is equity in the title?
It does not. It is
Oh, good.
bridging
Take it off quick.
rural healthcare access,
Lovely.
Great.
which is equity work, right?
Yes.
But I was excited. So about 3 weeks before it was due, we stopped hearing from our federal partners. And I was excited when the portal was still open and I could still submit. So we did that, and we'll see how that goes. Even if we don't, and I don't anticipate receiving any funding, just because you're never successful on a first go. But what it gives us is some feedback on how we can take what we're proposing, which is really planning for community health workers to meet people in those rural places, to help them know their numbers around diabetes and around blood pressure and around just some of those other baseline health indicators. How can we take that and then find another funder to support that? So I'm excited.
Great.
Lindsay, our new health educator, she's been with us for 4 months and already has a federal grant application under her belt. We are so glad to have her. So I
That's
just wanted to
great.
put that on your radar, also recognizing that it's equity.
That's great. We just won't call it that. Do you want to do finances?
So finances, you have end of year.
Yay.
And so what you'll see is that we anticipate coming in about 30,000 to the good. You'll actually see that we're showing 58,000.
58,000.
But that's really, there was a county levy support of what we expected to have in staffing for vacancies. And so
Right.
we have had some significant vacancies. They have stayed vacant instead of filling them. And we worked really hard with our long tenure public health nurse to use all of her leave before she actually left. And we were able to use public health ARPA dollars to offset that cost while the work still needed to be done. So I'm excited for that. And no update for this year because the data is not necessarily reliable at this point.
Yeah, this is only February.
Yep.
Any questions on the end of the year? All right, thank you for that. And thanks everybody for the discussion. Item number 10, Department of Human Services. Ms. Winter, it's in your court.
Thank you. And I don't want to bring up the GOAT open records request, But I will say it is also for our department, and everything we do is also related to that, and
And ADRC,
is
yeah,
part of it.
it's
And,
everywhere.
it's people, and we receive contracts from the state, and every one of the state contracts say you must have language as this is how you must work. And all of our purchase service contracts, when we contract with the provider, has that same language in. So we have trainings, we have all of the things that we will be needing to report on as well. So not to get into deep discussion, I just want you to be aware that rolls.
I know, but when we first experienced this, we said, this is what we do. This is our work.
Yeah, this is
So,
who we are. Yeah, right. So just wanted to put that out there. I also just wanted to mention, because Diane did ask us to share in our messages this evening, the impact of some of the information that we have received. I have been watching not only or participating in Wisconsin, WCA, WICSA, our Human Services Organization, also NACO, which is our national organization as well for counties, watching what's coming down and what that looks like. The major issues for our department, there's a lot of them, but the ones that are really standing out is the social service block grant, which is a majority of our funding. And then, of course, Medicaid and SNAP dollars. So I just wanted, because I think there's a lack of understanding, not from this board, but from community. What does SNAP mean, right? And so SNAP means the meals that our seniors receive in their homes. SNAP means food in schools. SNAP means food share programs. SNAP means daycare providers' food for kids and those kinds of things. So SNAP is really broad, and it doesn't announce that in any of the releases that are coming out, but just so you understand what that means. And then, of course, Medicaid, which we don't know how that will all look, but just aware of that. Of course, there's concerns about our partners in our communities on housing funding for like HUD and those areas, and that really impacts our consumers. So we're looking at that. And then I just want to say overall, because of the rural populations, the diversity of people that we work with, there's a lot of fear around what's going on. And so our mental health clinic is certainly seeing that. The workers that are working with consumers are certainly expressing fear and not sure what to do with all this. It's that uncertainty. And so it's impacting mental health. And we're just going to see realize some of that right after COVID, where mental health was an issue. So I just want to bring that up as an awareness for you. Even though we don't have answers, it's certainly impacting with that. So that's kind of that piece of it. I put in my report, the financials. So even though you don't have an updated 2025 financials yet, you see the cost of the placements that are really out there. I do want to say that in the governor's budget that came out, he did have in there that the state would backfill the additional costs with Lincoln Hills. And so that was his request. Of course, we know there's a lot of processes before that will ever get washed out to see what that will be, but at least it's in there as a starting point. So maybe that won't be on the counties, that additional double costs. So we'll see how that all comes out. There was also some good stuff that if some of that happens, it would help counties, of course, but we'll see where all of that comes out in the wash with that. So any questions on my report? We did have babies too. In fact, we just had two of them last week.
We have lots of people.
We had two of them in the same day, like by the same mother. So that was a little fun. Yeah, two girls. But we have lots of babies coming too. So that's fun. Any questions on my actual report?
Paula? Always an informative report and the finance report from
So
last
the
year's.
finance, so let's talk finance. First of all, I want to kind of jump ahead a little bit in the resolution for the carryovers for 2024. Sure. I just want to mention that when you look at the financial summary that we're at right now, which we'll have one more. This isn't our final because we still have some revenue, we still have some expense out there. But right now we're projecting, at that 446,482. What happens though with the carryover budget is some of those dollars get carried into next year. So that amount really isn't accurate because what happens is we have grants and things like that we receive funding for in 2024 that we didn't expend and will do so in 2025. So that money is then carried over, but it's not in our fund, in the fund
It's not in the
balance.
fund balance.
Right. So what happens with that is once we take that carryover, if you're using that $446 amount, we actually have 323,115 that we did not spend. So in the allocation that is allocated for us, but we did not spend that portion of that when you calculate that carryover cost. And so, that will be shook out just a little more next month, and we'll have that for you, and then we'll start reporting 2025 after that. So
That's great.
we're
Thank you.
sitting good right now.
Yeah, it
Yeah.
looks very good. This is good management all around under difficult circumstances. So I hope the committee appreciates that level of work. Yes, Supervisor, Mr. Lamb.
Quick question.
Yes, you can.
I maybe should have asked this before you skip to finances, but this has to do with potential Medicaid cuts. And again, nobody knows anything, but something popped back into my memory. A senator said something, a Midwest senator, could have been Amy Klobuchar, I'm not sure. But what popped back into my memory from my old life is children placed on foster care, their parents, for whatever reason, may not have health insurance. Foster care puts the child on Medicaid. That
Them eligible for Medicaid.
makes them
Yep.
eligible for it. And so, all right, I
Yeah.
wanted to reconfirm that tidbit because that's the only stupid question I had.
Currently,
Oh, it's not stupid.
Yeah.
currently. I can't
Currently,
commit
you're
to
right.
anything in the future, but
Right.
currently, a child placed in care then receives,
That,
Badger care.
Badger
Yep.
care.
yeah, all right, thanks.
Right. Anything else? All right, then we're moving, and as I said earlier, we're gonna be slightly repetitive in trying to systematize these procedures, but we're gonna move to agenda item number 11, which is, and the agenda was in error. These are the January DHS vouchers. The amount is 596,922. And as you recall, on these vouchers, this is our checkbook, right? This is our check register. And we don't approve these expenditures since they have already been made, but we review the expenditures. Does anybody need any clarification or have any questions about the vouchers? Supervisor Bashan, all right. I would entertain a motion then to
I
note.
would move to note review of the DHS just January 2025 vouchers.
All right.
A second.
There's a second. Is there any further discussion? If not, are we ready for the question? All in favor of noting review of the January 2025 vouchers, say aye.
Aye.
Any opposed? I'm still here. All right. All right. And then moving to item 12A, a carry forward for veteran services. We'll get clarification on this from VS Officer Quinn.
Yeah, the total amount consists of requests or donations that we receive for medical equipment as well as general relief amounts. So that combined total is $8,914. Would I draw your attention to a correction that I note? If you look on the back page under Veteran Services, the
numbers are-
incorrect amount was inputted in there. It's already been corrected and uploaded into the CFO's resolution
So the
folder.
correct amount is 8914
Correct.
or the 8959. I didn't notice that. I really didn't.
Yeah, I caught it when I then was preparing. So.
So it's the 8,
So
9,
it's the 89114 is the carry forward amount.
Okay. So, any other clarification on this? I need a motion.
I so move
Dr.
to
Hall.
approve.
Dr. Hall moves. Is there a second? Supervisor Bashan seconds. Any further discussion? If not, the motion is to approve the 2024 budget adjustment carry forward to 2025 for veteran services in the amount of 8914. We have a motion, a second. Ready for the question? All in favor? Any opposed? That moves forward. Agenda item 12B. And I will turn this over to Paula. This is a long set of carry forwards for the Department of Human Services, total amount being $261,325. Ms. Winter, will you explain, please?
Sure. This is what typically happens at this time of year. We believe we're going to get a contract for such an amount. And we estimate that based on history or what we know at the time of creating a budget. And then the contracts come in and we go, oh, surprise, this is a change from what we had estimated. And then we need to do the budget adjustments for that. So that's what you see for the 2025 budget adjustments. And then the carry forwards for 2024
Carry
Are-
forwards, I put the carry forwards first.
first. Oh,
Yeah,
I'm sorry.
It doesn't matter. It was the way it was listed.
Okay. So the carry forwards are the grants or funding that we received, donations or grants that we received in 2024 that were not spent, that need to be spent in that same area. So they can't go back to the general fund. Or can't go to the general fund. So then we carry them forward and ask for your approval to do that.
So this is the large grant and then donations. All right. We're gonna, I think we need to act on these separately because we've got
Two separate ones.
two separate
Yeah.
resolutions in front of us. So this is the resolution that reads approving 2024 carry forwards.
Mhm.
And again, the amount is 261325. Any further clarification needed? If not, I will need a motion
I so move,
to
Madam
approve
Chairman.
the carry forwards.
Second.
And Mr. Lamb seconds. Any further discussion? If not, all in favor, say aye. Any opposed? Passes. And now we have the budget adjustments.
Sure. So bring forward what I said before. So these are the adjustments in the grants, what we actually received in grants. And then I also want to point out that on the second page or backside of this, there's a Fund 2105. And that is the fund that carries the opioid settlement. And that was charged with this committee to begin that process of moving that forward. There has been a couple additional requests made for that. One was a community partner that we typically receive a grant for from the state. That grant was reduced because there was more counties that had requested funding. And so they asked for some of the things that typically that grant for people that typically work with our department, such as the fentanyl test strips and the so some of those products and things there. And then when the sheriff's department asked for funding for wellness for officers, which is also one of the criteria, there was a portion of the staff in the emergency 911 system
Yeah.
that weren't included in that. And so we wanted to expand it to that category. And so this is requesting approval to take additional funds out of there for those purposes.
Okay, so this is 188,570 in human services budget adjustment and 25,452 in the opioid settlement for purposes as outlined in the resolution. Okay, any further clarification needed? I'll need a motion on this.
Do you want the motion separately or combine them?
No, one motion will suffice. And that's what you're moving?
Yeah, I would so move, Madam Chairman.
All right, do I have a second on this one?
I second.
Supervisor Hagan, any further discussion? If not, all in favor of approving the budget adjustments for the Department of Human Services? Any opposed? It carries forward. So I think, without any announcements, or yes, Supervisor Steen.
Health Department.
Oh, right, I'm sorry, I forgot one. Thank you. Good thing that you all here and keep
Oh
me on
gosh,
my
did I not
toes.
get it in the packet?
No, it's here, it's really here.
Okay, awesome. So this is, again, Public Health ARPA. We really were told for years that we would not get an extension. We ended up getting an extension in late November. And so now it's back in front of you. This is the unspent amount of our total that we received starting in 2022, I believe. So there's 52,000 there, and we would like permission to use it again for the things that you've already been apprised of around Bursa 3 and other items.
Mhm.
And one thing I would share is we don't currently have an extension contract yet. So we are expending to this grant with the anticipation that we will have a contract, but that is one of the hiccups in the, this is federal pass-through dollars.
Sure.
So just to make you aware.
And surely it would have been nice to have this at budget time, but
It would have.
whatever, we'll do a budget adjustment. All right, any further clarification on this one needed? I need a motion to approve.
I so move, Madam Chairman.
All right, any further discussion? If not, all in favor, say aye.
Aye.
Any opposed? Budget adjustment for the health department passes. And now we might have an announcement. Supervisor Steen.
Well, this isn't an announcement, but I know I speak for everybody sitting at these tables that this department, this committee is committed to doing what's best for the residents of Dunn County. And I'm sure that we will, my heart goes out to you folks that are on the hook here on running these departments, because it's going to be awful hard. But just know that I know that we are all committed to doing what's best for the welfare of the citizens of Dunn County. So I just want that to be put in the record, because I know I speak for the whole board, and I know I speak for all of our departments also. So thank you.
Yeah, thank you for that, Gary. I certainly agree. We all agree. Yes, Supervisor Hagan.
Point of order, Supervisor Steen, do you want that noted in the minutes?
Yes, I would.
Thank you, Cassie. All right, and thank you for bringing that up. Anything else? If not, we are adjourned. See you on March 27th. I'm sorry.
Smooth as.
Yeah, not.
Only had to be corrected 3 or 4.
I only had to be corrected 3 or 4